Welcome back to the new norm. I'm Dr. Lou Graham, and this is brought to you by Midway Dental and Catapult Education. Before we get into today's segment, which is going to be getting a little bit more into teledentistry, and I've got Mark Genuis back with us from ICE Telehealth, I just want to talk about why I still believe this is going to be absolutely crucial for offices to start implementing this really this week. Based on everything we're seeing, including the latest from Washington, we're going to be in this emergency care only probably for a good 2 months. It's just the way it's looking right now. So for many of you who don't know this, the state of Oregon is pushing out non-essential services till September 20th. So when I'm looking at what's coming down, I think teledentistry really becomes essential. Equally, I was saddened by the fact that as my wife, daughter, and I drove home from Florida this past week, we were kind of down there because I went down there for a week and now it ended up being 3 weeks. As we drove back to Chicago, I was dumbfounded after literally at each gas station stop, at each convenience store stop, I was really amazed how people were not practicing social distancing, filling up gas tanks with no barriers, touching their face right afterwards, including a FedEx guy, going into the convenience store. I love red licorice. And I couldn't believe people were just talking to the cash register. I mean, not to the register, the person, the cashier behind it. They were talking to each other with no distancing. It was just crazy. And openly, here's why I'm concerned about this. We have been shown that social distancing is essential. I went to Emory Dental School, and as I drove through southern Georgia and then on my way to Atlanta, what's going on is the fact that Albany, Georgia, a town of 100,000 people, so it's a relatively large town in Georgia, but small in comparison to New York, Chicago, or New Orleans. They already have over 240 positive tests, people who have become symptomatic, and already 17 deaths. And I'm reading that if rural America ultimately gets hit harder, that's where teledentistry really becomes even more important. So I do think this is something, and it's so simple to do, and we're going to really dumb this down today with Mark Genuis. So Mark, welcome back to the show. It's great to have you. Give me some initial opening thoughts, and then we'll start going right into the system. Open it up with me, Mark.
Sure. Look forward to going into the system, but from a macro perspective, I completely agree with what you're saying. In this time of crisis, people are used to relying on their dentist, a professional they trust, to help them both deal with issues, but also prevent issues. When you have people now isolated in their homes, less active, eating more and let's say a greater variety of foods because they're just always there, you're setting up for a massive amount of decay and issues going forward. And one, I think, the most important way to help prevent that and to care for people is for dentists and patients to continue to stay in contact during this time. I think it's an absolutely essential service. It's critical because the amount of oral ill health, if you will, that we're about to see is substantial.
No doubt. And we have Myles Cone, who's a dentist out of Portland, Maine. He'll be doing a webinar through Midway Education. And what's really interesting, Miles's eyes were also opened up when you did the demo for him. And when I took the demo, I was kind of shocked how easy this is, because basically, even though you have ICE Health Systems as a software, this is a separate, it can be included in it, but it can be really a separate component in itself. And it's so simple to employ into your office, if you ask me. The opportunity that when you walked me through this, Mark, was that when I basically pay my $75 a month, which I think is a total bargain, basically I get a username and password, walk me through this, And this starts live tomorrow in our office. And basically, when a patient calls the office, the triage will get to me, and I'm just going to send them out a link. And then as soon as it pops up, it's HIPAA compliant, and they're just talking to me, and I can see them visually one-on-one. What did I miss as that as my 30-second elevator pitch on this product?
In 30 seconds, you really nailed it and nailed a lot. The first and foremost
Yep.
is the security. So
Yep.
you talked about HIPAA compliance. The system is HIPAA compliant. It is. We use one of the big six firms as our external auditors, and it's the first system in the world to be on track in 2020 to achieve ISO 27001. So it is globally standardized and at the highest level. That's first. And then second, it has to be really easy. This is built for use across the world, not for one or two people. And so it has to be that easy for your patients. The doctor needs to be in control of the sessions, so you send the patient the access when it's time for the patient to get on. The patient need not download anything, log in, sign in, none of that stuff. They click
Right.
the link, give you their name, and they're there. It has to be that easy, and the doctor has to have control. But the third thing, and then we can go in further into the weeds if you want, is you mentioned it right off the top. ICE Health Systems is a full practice management system, but you do not need to be using the full practice management system in order to use the telehealth. It's a standalone item, and we're happy during these times to make it available for people for as little as we can possibly afford, so that we can just get it out there and dentists can be meeting with patients. We're all in this together now. I need to see my dentist. I need to see my periodontist. Let's go. Let's take care of our fellow human beings.
So let me ask you a question. And again, I don't know this. If I knew it, I wouldn't ask you the question. So let's say I see Mrs. Smith and I need to talk to the periodontist about Mrs. Smith. I can send the
Yes.
periodontist a link, pull up my own information on my own laptop from my office information. He or she can do the same as my periodontist. If I do that on Zoom, am I HIPAA compliant? I know your site is, but everybody's Zooming, so to speak, and the last thing I want to do is something that's not HIPAA compliant. Is Zoom HIPAA compliant also? I'm just curious.
Sure. Zoom has what they call a health version. I believe
Okay.
it's considerably more. I believe it's considerably more expensive.
Okay.
And the issue with and without putting any system down,
Right.
one of the things that we see as most important is that people don't have to download anything. So we don't have access to the patient's personal information. We don't
Right.
have access to your desktop. We don't have any access we shouldn't have. That's the security. The security is also the privacy. And when you're downloading apps and so forth, you're giving up your privacy. I'm sorry. That's just the reality.
Right.
And so it's essential that this is simply browser-based. It's less expensive. And all we do is healthcare. And so all we focus on is healthcare. And you mentioned also, you're right, doctors and dentists are using it not only to see their patients, but they're using it to consult with other professionals. They're also
Right.
using it for CE meetings where they're discussing patient cases, because you can do that within ICE. And again, you don't have to have the practice management system. You can use screen sharing and show your current practice management system and show the case and discuss it with colleagues. You can have 30 people active in a meeting at the same time. So you can do all of that and more, yes.
Okay, so let me ask you, as far as experience goes, and I know you and I were talking one-on-one earlier, the UCLA healthcare system has been using ICE for a few years already. Can you kind of go into it a little bit with UCLA? Because I know we're not university-based offices, but
Right.
I'm just curious.
It's a wonderful. We used to their credit, they've shown it. The people at UCLA, Bill Piskorowski, the dean, Lisa Wynn, have been tremendous leaders. And very early on in our release process for telehealth and other elements of the system, they took the leadership stand to test this out. And instead of using it in the school, they used it in more like a private practice setting. So they have a community-based clinical education program where
Right.
students go out to community clinics and see patients. So they're
Right.
supervising all of their students throughout the state from campus using this system in other parts of ICE, and it's been an exceptional success. Their program has grown tremendously. They do a phenomenal job. They're spreading across the country, and they very generously say that they can do that because of the way ICE Health Systems is able to serve. So we're really honored. We're grateful for their leadership, and it's great to work with them. And again, they use it not in the school, but out in clinics like private practitioners would be doing.
Right. I mean, I just, I know it took, in a sense, a horrible virus and pandemic to create, obviously, the awareness of teledentistry. But to me, this process is so simple. I mean, basically, you go to ICE at midwaydental.com. You can register. This is a monthly cost. It's not like you're entering into a long-term contract. If you see that you don't want it, then you can exit out. I'd much rather visually see an emergency before they walk in my office. So I'm all over this, and it sounds so futuristic, but it's really not. It's really an essential system as I see it, with really not much confusion to be under. It's really a simple product, if you ask me. Not demeaning you whatsoever.
Sure. Well, I hope it is simple. It's the more simple it is for the user, the better it's going to be, and it's complex on the technical side.
Of course.
In order for it to be that simple. So,
of course.
No offense taken. I hope it is.
Right.
The other thing that, as you're mentioning, is that it sounds futuristic. The reality is, the other thing we're very pleased to be seeing is that where doctors are starting to use it now, they're saying, "Son of a gun, there are some efficiencies here. When our offices reopen." Right. I'm going to keep using it for certain types of meetings and appointments and et cetera, to be able to improve the revenue flow, the care, the access, and the efficiency of my office. So you're right. Unfortunately, a virus has taken this to push it in.
Right.
Let's get serving and let's get care, and then let's improve for the future at the same time through it. And we're honored to serve and grateful.
I was on a Zoom meeting lastly. I was on a Zoom meeting, and an orthodontist in Naperville, who I'm going to try to get on the show, she does a ton of Invisalign, and she's monitoring her patients literally right now, and this is what she's been doing through teledentistry. So literally they come to the office, there's somebody outside waiting, they text, they deliver their trays, and she's monitoring them. And she said yesterday she did 68 consults, and they're quick,
absolutely,
they're easy, but this is how she can keep her practice fundamentally going, and she calls it a godsend, and I love absolutely. That, because again, I would have never have thought of this. So kudos to you and what you're bringing to dentistry. Any last thoughts at all? Any?
A little. Yes, I'm grateful for it. A little bit of creativity goes a long way here. The technology is here to serve. It's secure, it's stable, and it's accessible. And we have a lot of patients who need care. Please go forward and care for them.
Yeah, well, we'll be implementing this first thing tomorrow morning. Thanks so much, Mark. Thank you. I can't thank you again for coming back on the show. Truly, thank you.
Thanks for the time. It's a pleasure. We'll talk again.
You got it. So let me be clear. We want to hear from you. We want to hear your questions. So what we want you to do is we want you to go to education@midwaydental.com. Shoot us your questions. We'll go right to the experts. I know I'm not the expert, so let's go ask the experts what we should be doing as our next step next week, the week after, and thereafter. I look forward to hearing from you.